What is food security? Does anybody know? Go ahead.
Knowing that a person has food when they need it on a daily basis.
Yep. So it's the availability of food and one's access to it. Thank you so much for volunteering for that. So our work is to end hunger and to make sure that people have nutritious food that they need. And we do that because food matters. It has a big impact in the lives of the community. And just like this, the first slide says, hunger hinders and food fuels. And so what does hunger look like in Colorado? So just like in the introduction it was said, so 1 in 11 Coloradans currently struggle with food insecurity. And 1 in 8 kids in the state of Colorado are hungry, not knowing when or where you will get your next meal, and not having enough money to purchase your meals. That's an issue that impacts people of all ages, backgrounds, and zip codes in the state of Colorado.
Great. So we're going to just tag team the state part, and then we'll have a little more consistency throughout the rest of the presentation. But, you know, I think we oftentimes think about hunger as a basic need and a human right, which is a great way to think about it, and hopefully that's a way that everybody in this room thinks about it. But we don't always very deliberately and intentionally tie it to outcomes of other things that we're working towards. So I think really being clear about the link of hunger and food security to things like educational outcomes and health outcomes, and really thriving economies and thriving societies is really, really important, I think, for us to be able to bring new and different partners to the table to talk about this work. It's not just anti-hunger work, it's human work. And so bringing our partners and really making these deliberate links. So this is just one slide, but thinking about food security in children, we talk about healthier babies, we're talking about longer gestation, higher birth weights, and lower infant mortality. Those are things that drive a lot of people. Improved educational outcomes and higher test scores, super important when we're in a state where we're really focusing our administrative priorities on education and access to education. Improved early childhood development and higher long-term returns on human capital. There's an economic argument for hunger. Significantly lower rates of obesity. There's a healthcare cost argument for hunger. Secure attachments and better mental proficiency at 24 months of age. There's a parenting component of hunger. And fewer school absences and visits to the school nurse. Again, both costs and educational outcomes. So I think, again, just it's being able to, you all are attending this, so you probably know this already, but being able to very intentionally tie this work to us having a strong and thriving society and community. Similar when we talk about adults, we're talking about reduced obesity, diabetes, and malnutrition, heart disease and high blood pressure declines, lower levels of stress, anxiety, and depression, which we know is an issue that's plaguing our communities, particularly here in Colorado when we talk about suicide rates. Decreased depression in seniors, higher educational attainment in adults as well. Seniors, again, we talk about healthcare, physical and mental health. Obviously, those returns are there. There are significantly reduced rates of preventable hospitalizations within the senior population. Nursing home utilization, which is one of the primary costs of bankruptcy for seniors, is also reduced with food security, significantly reduced healthcare and Medicaid costs as well. So again, like we're really looking at some really strong impacts of hunger, not just on a day-to-day basis of the stress and anxiety that causes, but people's ability to kind of continue to be thriving members of our communities. Food security and behavioral health, I talked about this a little bit before. There is some really strong linkages to these. We don't have causation data here, but the linkages between adolescent suicide and food security are strong. The linkages between depression and anxiety in all populations are really strong. And again, with that early childhood population, the attachment and mental proficiency is strong. And lastly, I touched on this, if this isn't enough argument, talking about the well-being of our population, talking about our economy, there are significant return on investment to ensuring that our population is food secure. So we're looking at between $1.2 to $2.1 billion in healthcare costs due to hunger in Colorado. When we talk about SNAP, which is a program I'll talk about during my presentation, it directly saves over $1,400 in healthcare costs per person per year. When we talk about WIC, which is a program for pregnant women and children under 5, for every dollar we spend, we save $2 in healthcare by the first year. And when we talk about long-term returns on investment, we're talking about $4 by the age of 18. And again, I think even the return on investment is incredible. And then when we talk about these programs from a federal perspective and the dollars that are flowing through our retail, here in Colorado, we've got about $1.4 billion in economic development that is going directly to local retailers and communities because of those two programs. And if we could increase enrollment, we would have another $500 million in that.
So just like Erin talked about, so food security in our community means, inadequate food support. Sorry. So just what Erin talked about, so just having an adequate amount of food supports the foundation for optimal health and well-being in our community. And when people don't have access to healthy food, it makes them make choices. So in Colorado, what that looks like is with a high cost of living, people have to make a choice. If they don't have enough money, they might sacrifice buying food in order to pay their rent. Or they might sacrifice paying their electric bill in order to buy food for their children in their homes. So the work that we do matters because it helps people not have to make choices in their daily lives. And then from here, I'll just turn it over to Erin, and she'll talk more about the blueprint.
So I'm going to talk today just, we're strategically selected presenters in that, being able to kind of talk about the statewide landscape and then some of the program work that's happening across the state, as well as kind of more localization in the city and county of Denver. I would say I'm the least expert, I don't know how to say that, but of our panel. And the blueprint is really kind of a collective impact role. So our expertise comes in the expertise of our partners. I am not the food security expert at the table. My background is actually in public health for 15 years, so I have a pretty broad vision. And I'm understanding and learning a lot about food security in the 6 months that I've been in this role. But the technical questions, I'm really excited to be on stage with these two women and privileged to be part of this. So I'm going to talk a little bit about just the background of the blueprint, so why we were created. I'm going to talk about the vision and the goals that are laid out within the blueprint, and then the progress to date. So I alluded to, I've been in place for 6 months now, and I'm the first staff person for the blueprint. So we've been doing a lot around just building up some infrastructure that we'll talk more about. So in terms of the background and timeline, in 2015 and 2016, the Colorado Health Foundation worked with a couple of consultants to do a statewide listening tour. They were doing that as part of kind of their shift in funding priorities and really trying to understand what the analysis of, understand what hunger looks like in Colorado. So they convened in June and July of 2017 a group of 37 stakeholders to kind of share that data out, have some conversations about what was happening in Colorado, what wasn't happening, and really understand kind of what we needed to do to all be on the same page to get to ending hunger. Because I think one of the exciting things about the anti-hunger field is that every advocate that I've worked with in this space believes that it's a solvable issue. There's a lot of complex issues facing our communities and our state and our nation and our world. And the amount of hope and optimism around this space, in that it is eminently solvable and it's solvable relatively quickly, makes it a really exciting place to work. So, I think that the groups were really wanted to make sure there's a lot of work happening in this space. There's a lot of resources going into this space. How do we leverage those? How do we streamline those? And how do we maximize kind of our effectiveness and our efficiencies? So the blueprint itself was released in January 2018. And as mentioned, it's a 5-year plan to end hunger in Colorado. Luckily, the 5-year clock did not start in January 2018. It actually started a month ago. So now it's a 4-year, 11-month clock. And we're funded by the Colorado Health Foundation. But that document really lists out kind of a common vision to ending hunger in Colorado. So what is it? So it's a collective aspirational document. Again, we have a vision, we have 5 goals, and we have a number of potential strategies that we can be looking at as a state to make impact in this issue. It's really meant to catalyze leadership of people already working in this issue, or to bring on new partners and be able to kind of leverage resources to move the work forward. The Blueprint is not an implementing body, so we are not going to say we have the magic bullet to ending hunger in Colorado and we are going to implement it ourselves. There are a number of brilliant people, including these two women up here, that have been working in this space for a long period of time. So our job is to really lift that up, support it, and build on it. So the Blueprint Steering Committee, I think, was really unique because there are very few states, number one, that have a common vision around ending hunger and how to do that, and also unique in that who we were able to bring to the table. So we had a number of the state agencies, Public Health and Environment, Department of Education, Healthcare Policy and Financing, which is where Medicaid lives, Human Services. We had the advocacy partners. We had the Colorado Center for Law and Policy. We had the Children's Campaign. And then we had consumers and constituents, so people who are experiencing hunger. And then a number of partners kind of in between on that spectrum. We had retail partners, so thinking about the grocery stores and their investment in us ending hunger in Colorado. So it was a really exciting, I think, group of people looking at this issue from a number of different lenses. One of the things that, I've realized and has been very humbling since I started in this role, we all want to have like the perfect program and the perfect project, right? The one answer to our problem. And I think that is what is drives us, right? And this has been a really great process and a really great experience to be able to kind of navigate, because I think what I've realized now is there's probably 1,000 different solutions. And so we have to figure out how all of those solutions can be kind of moving in the same direction, but there's not a silver bullet to this. There's not one thing that we can do that will automatically kind of change the landscape of hunger. So really understanding that there's a number of different lenses to which to approach this, and then the desire of the steering committee to make this work really driven by people with lived and living experience in this space. So I don't experience hunger, and so I can't tell you exactly what those barriers are the same way that somebody who is experiencing hunger can. So really making sure that we're bringing in community members, hearing their voices, and having them lead when and where is appropriate. So in terms of the vision and goals, so the vision is that all Coloradans have access to affordable and healthy food in their communities. The vision is that we end food insecurity in Colorado. The goals that we laid out in the Blueprint are pretty broad and pretty huge, some of them huger than others. But one was really focused on increasing public understanding and awareness that solving hunger is vital to the health and well-being to all individuals and families, the Colorado economy, and every local community. So this is again around, what is the current perception of hunger? What do people think about it? We know from voter polls that Hunger Free has done in the past, people care about the issue, but people may not know that it's an issue. And so thinking about, what's our role in terms of changing that awareness, taking away some of the stigma that comes with a lack of food, and kind of the shame that is associated with that. And thinking through the work from that perspective. Also, what kind of work do we need to do with our policymakers to make sure that they're aware of this as an issue when they're thinking about different policies and laws for the state. Goal number 2 is increasing the number of Coloradans who can access affordable, nutritious food in their communities. And this is really, we're actually rewriting this goal, but is really from a retail perspective. So where do people have a grocery store in their neighborhood? Can they get to it? So thinking about, how our food systems are actually serving our communities. Goal number 3 is very similar, but focusing on kind of the charitable food system. So our safety net is food banks and food pantries. They're pretty robust, and they can be better. We can be increasing the quality and quantity of food that is moving through those systems and making sure that people understand they're accessible, and identifying if there are gaps in communities where those services are not available. Number 4 is around maximizing SNAP and WIC enrollment. So these are 2 programs that, particularly for Colorado, we are ranked in the bottom 5 in the nation in terms of our access to these 2 programs. So WIC, I think, is 47th now in terms of reaching our eligible population, and SNAP is 46th, and don't quote me on that, although this is being recorded, but definitely the bottom 5. And so trying to figure out why, right? So we have, a county administered state, so there are variations in kind of the quality and types of services that you're receiving, but there are many states that have very similar systems that have those that have much higher access rates. And so really being thoughtful about how we can increase enrollment in those programs. They are a system that are available for people to access, and if people are not accessing them, figuring out why and trying to make some change in that. And then similarly, also looking at maximizing participation in federal child nutrition programs. So this is things like school breakfast, school lunch, summer meals, and the child and adult care food program. So summer food is another one we are doing very poorly. I think we're 40th, so it's better than SNAP and WIC. But in terms of reaching our children with food meals during the summer, school breakfast, we actually were one of the bottom and have made some really significant progress through policy changes over the last few years in terms of breakfast after the bell. So that's been really exciting to see that availability for students. But there are some policy solutions in that space, as well as programmatic ones. But those are the five goals. Just in terms of policy, that's something that we've been focusing on. So we have a separate group that's convening of all of our partner organizations, and are really looking at how do we think about policy jointly versus Hunger Free Colorado having a policy agenda and Live Well Colorado having a policy agenda and the Blueprint to End Hunger having a policy agenda, really creating a shared anti-hunger platform. So I'll talk about what that is in a minute. And then we're also going to be organizing a large joint anti-hunger day at the Capitol. So that's March 4th, if anybody's interested in attending, put that on your calendars. And we're just in the planning phases of that now. Lastly, with this group, we are really focusing on kind of what some of the cross-cutting messaging is. So when we're talking about hunger, how are we all using the same language? How are we all using the same data points and making sure that we're really being clear about why this is an issue? And then lastly, we have hired a lobbyist who's going to support the policy efforts of this platform, which again are both policy priorities that have come up from Blueprint work groups as well as policy priorities that have come up from our partner organizations. So for this year, the policy priorities for the 2020 session are these three priorities here. And I'll talk a little more about each one, but I think the kind of overarching point is we really want to tackle this issue from a number of different perspectives. So we know that there's a system in place that can support people in becoming more food secure, which is kind of federal government programs, and we know that those are being underutilized. So we want to link more people to the system, which is increasing the state funding for SNAP outreach, and we're specifically focused on the student population within this context, so looking at early childhood all the way through higher education. There's some recent data that came out in a Colorado-specific university survey that 40% of college students are food insecure in any given month. So that's something we have to address. So we want to get more people access to the system that exists and that can be expanded on a moment's notice. The resources for SNAP and WIC are there, and we're not using them. We want to improve the system. So the next priority is really around increase in healthy food incentives for families participating in WIC and SNAP, and this also includes CSFP, which is not on this slide, which is a senior nutrition program. So really looking at access to fresh and local fruits and vegetables, whether that be through increasing people's purchasing power, so giving them dollars like a double up program, where a SNAP recipient can purchase fruits and vegetables and get double the value, or whether that's through things like community supported agriculture shares, so boxes of fruits and vegetables on a regular basis. So again, getting more people into the system, lifting the system up. And then lastly, looking at the increasing the food pantry assistance grant, which is the safety net. So who is either not being served by the system or not getting enough of what they need from the system. And that's where our food banks and pantry system is really kind of catching people who are falling through the cracks. So that last priority is really increasing funding for what's called the Food Pantry Assistance Grant, which allows food banks and pantries to purchase local meat, dairy, and produce. Not sure what that slide was. So work group one, I'm going to talk a little bit about kind of the projects now that we have going within each one of these goals. So as I mentioned, work group one is around building public and political will. So they have 3 identified projects that they're going to be working on over the next 12 months. So they're building out baseline data on public opinion, political will. We can't change something until we know what it currently is. They're providing communication support for the policy team. So when I talked about the common messaging and kind of the one-pagers, that group is really supporting our policy partners in what communications platforms we should be utilizing, and then are working on increasing SNAP and WIC awareness. So they've created some general kind of SNAP outreach materials, which don't exist in our state currently, that are just really basic, kind of, do you need help with groceries? Here's where to contact, types of materials that any partners in the state can download and use. Work group 2-3, so we actually combined two of the goals, and probably two of the biggest goals, which is an interesting choice, but is really focusing on increasing access to food in communities. So they've identified 4 priorities. Only 2 of those we've created project teams around because we have partners already leading the other 2. So we are having conversations with partners that are leading those 2. They're providing updates. We're providing support where it's helpful, but there's no need to duplicate in the space. There's plenty to do. So Healthy Food to Pantries, which is the food pantry assistance grant work. Hunger Free Colorado is leading that work. We're providing support. We've embedded that into our policy platform, but they're really taking the lead in terms of convening partners and having those conversations. Incentives for healthy food to families, another piece of our policy agenda. Live Well Colorado is leading work on this, so we are supporting them as is helpful. And then the 2 project teams that we've started up are increasing the number of WIC and SNAP retailers and also improving the customer experience. So we know the shopping experience with both of these benefit programs can be challenging, I think particularly with WIC. When you're walking into a store and you have to buy the 100% whole wheat 16-ounce loaf of bread, and you've probably got kids with you, trying to figure out what you can purchase and what you can't, can be really challenging. And then also increasing access to nutrition education where Coloradans access food. So, work group 4, increasing enrollment in WIC and SNAP, has 3 priorities. One is the legislative policy group. They were the ones who came up with the SNAP outreach increase in funding, and then they are also exploring what it would look like to increase the minimum benefit for both SNAP and WIC for those programs in 2021. And that could look like a number of different things, but just kind of starting to do some research about what that could look like. The minimum benefit for SNAP for an individual in our state is $16 a month. So when you're talking about really solving for food security, it's probably not high enough. Technology, they are looking at piloting telephonic signatures for counties, which gets a little wonky, but essentially ensures that counties can process an application over the phone without somebody having to physically go into their county office to get sort of enrolled in SNAP. And there's also interest in doing some texting work within that program. And then we're doing a lot of work around cross-program alignment, so streamlining access to Medicaid, WIC, and SNAP. We recently got some data from Medicaid that I think it's 46% of Medicaid clients who are children from 0 to 5 are enrolled in WIC, and we know 100% of them are eligible. So we have a population of about 90,000 kids right there that we know them. They're accessing our systems, but they're not accessing all of our system. So really thinking about how we can do a better job across those 3 programs to get people more holistic services. And then lastly, work group 5, which is increasing access to child nutrition programs. So they have 2 project teams which have started. They are doing some asset mapping work, so really identifying areas of the state where there's gaps in child nutrition programming. I don't know if Paola is going to talk about this or not, but I think it's over 40% of our school districts are on 4-day school weeks in Colorado. So we talk about what that means from a child care perspective and from a parenting perspective. There's also a huge impact in terms of food and where those kids are eating on that 5th day. Marketing, increasing the marketing of school meals. We've made some really significant improvements in school meals in Colorado. And again, that varies district to district, but it's been really incredible at what they've been able to do. And there's no resources towards kind of marketing what those improvements look like. And so how do we get parents that actually want their kids to eat school meals, or as kids get older, how do they want to eat them? How do we get them to want to eat them? We're also looking at 2 other things which we do not have project teams around yet, but we are kind of watching and tracking, ensuring adequate time to eat. We're just monitoring as there's a team already working on this, but in Colorado, in the Board of Education rules, time to eat is specifically called out as an exception to instructional time, so it cannot be considered instructional time, which is not the same as in many other states, so we're just kind of looking at that and watching that. A lot of schools have about 10 minutes for kids to eat school lunch, which is not sufficient. And then universal meals is something, again, not happening tomorrow, but when we talk about stigma and we talk about access to these programs, by making them available to 100% of kiddos, we would solve for a lot of that. And so really just starting to kind of look at what would that look like and what does that data look like. So yeah, again, I mean, I think this just highlights, in terms of the next steps for success, what I talked about a little bit earlier. There are so many ways that we have to tackle this, and there are so many amazing partners that are tackling it already in so many different ways. But really thinking about, this from just a variety of lenses and how everyone can be looking at this issue and thinking about it as kind of core and central to what they do. And with that, I'm going to pass it over to Paola. Thank you.
Bear with me, still get really nervous with public speaking, even though I've done it enough. But all right, so I'm going to talk about kind of like Hunger Free Colorado. So the blueprint, you can think about it being like the multi-organization effort, kind of backbone, trying to structure how we're all going to work together to end hunger in 5 years. And Hunger Free Colorado, we also work statewide, but we also have a lot of programming that works directly with communities. And I'm the community engagement and child nutrition manager at Hunger Free Colorado. So what we do is, our vision is for every Coloradan to have equitable access to the nutritious food needed to thrive and reach their full potential. And we do that by connecting people to food resources to meet existing needs, and also drive policy, systems, and social change to end hunger. So we're working to address the challenges that people face in their daily lives, while also looking at that big picture of systems, policies, and processes that can hopefully lead to a day when we don't have to have hunger in the state of Colorado. And then, kind of like we've already talked, by having equitable access to food, it not only leads to the improved health and well-being and development of our society, but also it leads to a highly educated and productive workforce, stronger communities, and a thriving economy. So I'm going to talk a little bit of all of the different programming that we do at Hunger Free Colorado. So our biggest program that we have that kind of started Hunger Free Colorado is our hunger hotline. So our food resource hotline is statewide hotline that anybody can call in and get connected to food resources. We do, when someone calls in, they get connected with SNAP, so they'll start the online SNAP application process. And then we also do on-site hospital referrals. So we're partnering up with a lot of different hospitals across the state of Colorado, so then they can screen their patients for the social determinants of health. And if they find that one of their patients is food insecure, they'll refer them to Hunger Free Colorado. And, we're really building out our network of organizations that we're supporting to also help do on-site SNAP applications. So we do a lot of outreach because we realize, we need to meet the people where they're already at. So we're partnering with a variety of different resource organizations, food pantries, so they can provide that on-site SNAP application. And also, when someone calls into our hotline, in addition to SNAP, we also get them connected with TFAP or with WIC, or with, if they have children, and it's in the summer, we get them connected with summer meals. If it's a senior, we make sure that we're connecting them to any senior boxes or Meals on Wheels. So we just get them connected to whatever it is that they need during their life circumstance that they're facing at the moment. We also focus on our kids. So because nutrition fuels success, we connect children to food in and out of the school time. So we've done a lot over the years to promote participation in child nutrition programs. Like Erin mentioned, we work a lot with Breakfast After the Bell, free and reduced lunch, the after-school meals and snacks, summer meals. With WIC, we designed, so just kind of like how Erin talked about, in the past there wasn't a really way to be able to promote, for people to apply to free and reduced lunch. So we created just a simple flyer that talked about the benefits for both the child and the school and why it's important to apply for free and reduced lunch. So we're just doing as much outreach as we can so to increase participation in these programs. And since 2009, the number of summer meals in Colorado has nearly doubled, and the number of school breakfasts served has increased by 50%. So this means that more Colorado kids are getting the fuel needed to help them grow and learn, setting them up for success in and out of school time. With Hunger Free Colorado, we also do a lot of collaboration. So we collaborate with a variety of different partners to identify innovative solutions and to continue making progress in this field. There's a lot of organizations statewide that are working on hunger, and that's why we're collaborating a lot with the Blueprint. So we have a lot of staff members that are leading some of the work groups. And with that, we're really collaborating as a state to try and figure out the barriers and what can we do to solve hunger. We also have our food pantry network, which is a network of 100 different food pantries across the state. And we let them come together so they can all share best practices, kind of what's going on in their communities. And kind of through that, the Food Pantry Assistance Grant came about through the Food Pantry Network, through the food pantry coordinators surveying their families on what was needed. And through that, they found that people really wanted more meat, dairy, fresh fruits and vegetables. And through that and the policy work that we do at Hunger Free Colorado, we were able to come up with the Food Pantry Assistance Grant, which I'll talk about a little bit more later on. And we also do a Hungry for Change Summit yearly, where, again, all of our partners and organizations come and we come together to just learn on what's going on and what can we do together. And then we also do, in the past, we did our Hunger Day at the Capitol, but this year we're going to do that joint effort on March 4th and have all of the organizations come for a Hunger Action Day. And then we also do a lot of policy and systems change in Hunger Free Colorado. So this looks like a lot of different things. Like, what are the barriers and how can we work locally and nationally to change policy? So we look at ways to increase the programs that are already set and to increase the reach of the programs that are already set to be that safety net for people's access food. So WIC, SNAP. So we kind of just help to identify those barriers and what can we do to change policy. And then and what can we do to make them better? An example of this is also we worked a lot with the Breakfast After the Bell legislation and to help pass it to support the increase of like that best practice model. So we realized that a lot of kids weren't eating breakfast at school, so what would be a really good way for them to eat breakfast in school? So the Breakfast After the Bell program really helps students eat breakfast when they're already at school sitting in their classroom. So it really helped support this legislation in order to increase the reach for kids to have more healthy meals at school. We also do a lot of educating and advocating to change the hearts and minds of people that they have around hunger. And through our Hunger Through My Lens program and through our community council, we help magnify the voices of those that are directly impacted with hunger. And we're taking them from being an applicant to being an advocate in their community. And this helps us raise the visibility of the issue and solutions to hunger. So with both of them, so Hunger Through My Lens is kind of like a photography platform where a while back they gave cameras to community members and they were able to document their experience with hunger. And through that, we're able to really put a visual on what hunger looks like in the daily lives of our community. And through our community council, this is a program that we're going to launch in December. And we're going to have 15 council members that are statewide, and we're going to meet, and it's going to be a two-way street. So we're going to be teaching them about advocacy, food justice, how to advocate for your communities, how to start like different community projects to help identify those barriers to food access and how to address that. While at the same time, we're going to be learning from their stories, and those stories are going to help us with the policy work that we do at Hunger Free Colorado. And then we also just do a lot of increased awareness and mobilize action. So we have an action network that people, if they sign on to that, we're constantly keep them up to date with what are the things that we're supporting that might affect the 1 in 11 Coloradans that are currently hungry. And then, so I guess going back to this one. So with the Food Pantry Assistance Grant that I completely forgot to talk about it when we were on this slide. When we figured out that like people wanted to have more access to healthy foods and stuff, so we helped to introduce into the long bill the Food Pantry Assistance Grant, which allows food pantries to buy directly from their local farmers. So we're currently working on connecting food pantries to their local farmers to kind of help keep that local purchase of the local goods that we have, while also allowing that to go directly to the community. And we've seen like a really good impact with that. And we're still doing a lot of work, and that's going to be one of our legislative priorities at our day at the Capitol. And then what can you guys do to help end hunger? So you guys can join Hunger Free Colorado's Action Network. And you guys will get alerts onto, like I said, any policies that we're currently following or anything. You guys can donate to Hunger Free Colorado. You guys can volunteer at a local nonprofit. You can share our hotline information to anyone that you know that might be experiencing hunger, or you can just talk about the issue to help us raise awareness. We just need more people to know that this is an issue and that more people need to be aware about it. I mean, hunger, you can't really always tell who is going through this, so just talk with your neighbor, your family members, to kind of continue raising awareness with hunger. And then, and with this, I'm going to talk a little bit leading into Mondi's presentation. So, Hunger Free Colorado, recently, across the state of Colorado, 14 food access coalitions were funded by the Colorado Health Foundation to start doing work in their local communities to address hunger. So 14 of these coalitions were funded to just make a plan on how they're going to address hunger. And so Hunger Free Colorado currently participates in 2 of the funded coalitions, and one of them is the Denver Community Food Access Coalition, and there's 10 different food access organizations that are part of this. And together we're just gonna really, we're gonna start recruiting about 20 community members to be part of this coalition, and they're gonna really help guide the work that we do, because we know that by community members being part of our coalition, they're gonna be able to let us know what's going on in their neighborhood to address hunger, and they're gonna help us really create a plan to try and address hunger in their community. So we're still working on, obviously this is a planning grant to help us plan the work that we're going to be doing, but hopefully by July we'll be able to have a plan of action and then apply to be able to actually do the work that we set out to do. But yeah, and I'll turn it over to Mondi.
Thanks. Hi everyone, I'm Mondi Mason. I'm a food policy program administrator at the City and County of Denver's Department of Public Health and Environment, and I am here to provide a little bit of a perspective about what a local municipality is doing in terms of working on hunger and food insecurity. In the introduction, Dr. Carlson mentioned that back in 2014 there was a report that was written, and it was really that report that laid the groundwork for all the work that I'm going to be talking about, hopefully speedily, so we can get to your questions and the discussion. But a lot has happened since 2014. The report actually highlighted the fact that the city was very disjointed in their food efforts and their food access efforts. So we had Department of Human Services working on enrolling people in SNAP. We had the Office of Children's Affairs that was in charge of after school and summer meal programming. We had the Department of Public Health and Environment that was doing a lot of community engagement and mobilizing around food access, and no one was really talking to one another. And so it really highlighted the need for a vision. And so since then, let me show you what we've done. But first, just to give you a snapshot, about 1 in 4, getting close to 1 in 5 children is food insecure in Denver. This number has decreased over time, and there's a multitude of reasons for that. It could be programs are working, we're getting kids plugged in, but it also could mean there's a lot of change happening in Denver. There's a lot of changing demographics. Neighborhoods are really shifting rapidly. People are moving outside of Denver. You can see here that about 12% of the overall population of Denver is food insecure. Almost 70%, a little less than 70% of DPS students qualify for reduced price lunches. And these data are a little bit dated because it takes us a while to analyze and write reports and all of that. But this is the latest, greatest data that we have currently. About 37,000 children are in households that are eligible for SNAP. So that's also, that stands for Supplemental Nutrition Assistance Program. We referred to it a lot, but it was commonly known as food stamps at one point. And about 14,000 children are in families enrolled in WIC, and there's also been a decline there. I'm sure Erin could share a multitude of reasons of why that is. Again, fear may be one. We have a lot of local and federal policies that might make people fearful of applying, but there's stigma, there's uncertainty about what that program offers and education there. And then also Erin mentioned the need for, or to also focus on college campuses, because there was a recent study that was released. There was actually, I believe, a headline in the Denver Post a couple of months ago that of the students that participated from Denver, you can see the colleges here, Community College of Denver, MSU, Metro State, UCD, and DU. Of those 3,000 students that were surveyed, 40% had said within the last 30 days they had experienced food insecurity.
Before you go on.
Yes, sir.
The first number and the third number seem inconsistent. Can you explain the difference?
The first number of the 15%.
15% versus 68%.
So I believe that the number of food insecure or the students that are qualified for reduced lunches, that's based on a different measurement in terms of percent of household income or percent of poverty. And so it's a little bit different because it's measured differently. That makes sense? So I wanted to just share that the City and County of Denver is really looking holistically. We're looking at the food system. We recognize it takes all of these players, consumers, producers, processors, distributors, to create a healthy and vibrant economy, healthy and vibrant communities. And so in 2015-16, we conducted a baseline report, and these numbers were highlighted in the baseline report. From an economic standpoint, Denver is a $7 billion a year industry, generates a lot, millions of dollars worth of tax revenue. There are 10% of our workforce in Denver works in the food system. Simultaneously, we know that more than 1 in 3 children in Denver is overweight or obese, while at the same time we have a lot of kids who are food insecure. And we also know that 1/3 of Denver families eat less than 1 serving of fruits and vegetables a day. There are dramatic health care impacts, as has already been mentioned, and oftentimes and this is rapidly changing as our neighborhoods change, but 49% of Denver low and moderate income communities don't have easier access to grocery store. Easy access is defined as about half a mile. So that's about 8 blocks from a grocery store. So after this baseline report, we developed a food vision. So we conducted listening sessions in every council district. We talked to industry partners. We had thousands and thousands of comments to sift through, analyze those data. And really the vision was, how do we create a more inclusive, healthy, economically vibrant, and resilient community in Denver? And you can actually go to this denvergov.org/food plan if you want to read the plan in its entirety. But just to walk you through some of these components or the principles or the priority areas, we really are focusing in terms of an inclusive city on what we're calling complete neighborhood food environments. And these are community-driven plans, if you will, for what people want in their neighborhood. We want more gardens. We want a grocery store. We want a farmer's market on the corner, et cetera. So it's complete food environments that are defined by the community itself. And we also have metrics for each of these goals that we've outlined within the plan. So you can see here that some of our, we're aiming to at least work with 5 low-income or underserved neighborhoods between now and 2030. We're actually exceeding that, and I'll talk a little bit about a program that we're working on to do just this. You can see here we're also looking at food insecurity as a goal, increasing SNAP eligibility, increasing adult and child food and vegetable consumption. This is the tricky one to measure over time because it's hard to link actual food access points within a community to what people actually consume. So that's, from an evaluation standpoint, that's the trickiest one. And we also are addressing sugary drink access, because what we're finding, and in community meetings, we hear a lot that if someone is purchasing a soda and chips, oftentimes that's breakfast, or oftentimes that's dinner for family. And so, because carbonated drinks kind of make you feel full, and it is often a beverage of choice to have a full feeling. In terms of economically vibrant communities, we're looking to increase the size of our food economy, which you can see it's really booming in so many respects around the city. This not only increases opportunities or access to food, there's an opportunity for workforce development there. So we're working a lot with youth and our local organizational partners to support them in training youth and entrepreneurial programs so they could work or lead food businesses. And we're also supporting local business owners through economic development grants and loan opportunities. And then we're also really focused, because farmland has reduced dramatically over the years in Denver, especially as we've grown in density, that we're looking to try to preserve land through land trusts and to maintain some of our green spaces for growing food. And there are very few of those places left, but Denver Public Schools is a keen partner in this because they have some of the most land available in Denver. We're also really focusing in a coordinated way on reducing food waste and food rescue, keeping food out of the landfills and redistributing food that's good into food pantries or local mobile markets where food is given away for free. So there's a big movement afoot where you have these large organizations that are moving food that's donated from either producers or restaurants or local grocery retailers into places where we can actually give food away to residents in Denver. So I want to specifically talk about food in communities. This is a new initiative that we started just about a year ago, where we're really trying to address food insecurity at the neighborhood level. This is a project that was funded by the Colorado Department of Public Health and Environment's Cancer, Cardiovascular, and Pulmonary Disease Grant Program. We received about $2 million, a little over $2 million, for a 3-year project. And what's unique about this project is we're working cross-jurisdictionally. So obviously, Denver is not an island. We're just across the street of Sheridan, or just across the street from Yosemite, to folks in Arapahoe or Adams County or Jeffco. And so we're working cooperatively with local food policy councils within Denver, Jeffco, and then local coalitions within Adams and Arapahoe County, as well as working with local health departments and other organizations. So because we recognize that access to food does not stop at the border. People don't stop at the border and say, well, I can't go shop over at that King Soopers, it's across the street. So we're really trying to work hard to work on boundaries to really address, from a policy standpoint, a food system standpoint, and food environment standpoint, to create neighborhood and regional change. So here you can see some of the focus areas that we have selected with the helps of our community partners and our food policy councils and many organizational partners around the region. The areas we really were trying to keep equity at top of mind. So we looked at household income, amount of income spent on housing, race, ethnicity, education levels, and there may be one or two more that I'm forgetting, but these were the areas that rose. Food access. So do you have a grocery store? Do you have other food access points within your community? So these are some of the areas that really rose to the top. There were some opportunistic decisions that were made too in this regard, because we are aligning closely with the city's neighborhood planning initiative, which is through community planning and development, that they're working on different kinds of plans on the east and the west sides of Denver. And so we're trying to align, this work is trying to inform those neighborhood plans, because before, I don't know, 5 years ago, none of the city plans had any mention of food in them. And many neighborhoods have either never had a neighborhood plan or it hasn't been updated in 15, 20 years. There's 78 neighborhoods in the city and county of Denver, and so it would take us probably 30 years if we were going to do them individually. So what they've done is CPD, Community Planning and Development, has started bringing them, kind of clumping them together, if you will, working with 3 to 5 neighborhoods at a time to think through what do you want in your neighborhood. Not just about food, but it's also about walking, pedestrian access, biking, transit, green space, parks, etc. So I think I have some mention of that here in a minute. I've gotten ahead of myself. But just to give you an idea, some of the things we're doing with food in communities, we're working really closely at the neighborhood level to identify assets and needs within those communities. We really want it to be driven by communities with lived experience related to food insecurity and limited food access. We are working with community members to develop action plans and then ultimately projects that will take place within their neighborhoods. So, for example, we've identified many food pantries in neighborhoods don't have coolers. So how do we build that infrastructure within food pantries so that they could have more perishable products like produce, milk, meats, etc.? And then we're also working really closely with local food policy councils, so JEFCO specifically, and then Denver's Sustainable Food Policy Council, to do a lot of policy one-on-one types of training, a lot of crosstalk in the region. So, for instance, one issue that keeps coming up over and over again is how do we extend our growing season within these urban areas, especially if you have limited land access, and so for growing. So hoop houses or high tunnels has been one potential policy effort that all 3 or 4 county jurisdictions could work on to get approval to have such a mechanism for continuing to grow and extend the growing season in the region, and thereby have more produce available to all of us, especially to food pantries, to schools, to corner stores, etc. So this is just providing some ways we're gathering data. We've talked to many people, lots of surveying, lots of listening sessions. And then, I have to say, people are feeling assessed to death at some level because they, it's not only the cities that are assessing, it's local health departments, it's now planning, it's state level partners, etc. So we're also looking at previous food assessments to help inform the work going forward, because we know people are ready for action. So this is just a picture of some of our great community residents and organizational partners. And then there's a ton of ideas. I want to give shout out to Martha Tinney. She's been one of our evaluators for our project and has been so incredibly gracious with her time and thoughtful approach to lifting up all that we've been hearing in the listening sessions across the region. Transportation is one of our number one issues. So people are having trouble getting from point A to point B. And then so we're thinking about how do we work with RTD, but also how do we get food to people? If you're an older adult, you have limited transportation, you have mobility issues. We're looking at a lot of mobile pantry, mobile market, mobile farmers market access to different housing complexes, to different neighborhoods, et cetera, to increase access. I've already talked a little bit about pantries. We're hoping to align with a lot of the other local and state efforts, increasing community food production, supporting our farmers to do that work, and continuing to improve options in schools. And then food rescue has just been an incredibly interesting undertaking as we've started working more closely with Public Works, with the landfills, with restaurants around town, with grocery stores to try to be more coordinated in getting that food rescued, tons and tons of food rescued and available for distribution to folks who don't have it. This is Zufan, one of our great Healthy Corner Store owners. She is off of 11th and Syracuse. I was just by her store this morning. And she has been trialing or piloting the Double Up Food Buck program. Erin's already mentioned that as a way to kind of get double the value of your dollar, essentially, when you have SNAP benefits. So she's been selling a lot more produce, adding more to her bottom line as a local mom and pop kind of independent grocer in that neighborhood, and definitely becoming a leader in this area as she's helping us sort of figure it out in Denver. So I've already mentioned like all of our planning that's happening. Many of you may have already be familiar with our Denver Ride Initiative. It's our comprehensive planning initiative. All of these plans, from transit to parks and rec to pedestrians and trails and land use, all of these plans feed into our Denver Right comprehensive plan, but all these neighborhood plans feed into this. So we're really trying to be intentional and coordinated and include food at every point we can, because that's what holds the city accountable. I've learned so much working for city government, but if it's in a plan like this, it's something to point to when you're working on policy development, when you're working with local partners at the city, that, hey, we said we're going to do this, let's figure out how to make it happen. This is just a page from the planning initiative from Community Planning and Development. I would encourage you to go there to that website because they list all the community meetings that are happening around town related to this initiative. This was Far Northeast, which was actually released earlier in the year and approved by council, but now we're on to the West area planning, and we have Central East and East planning, which feeds right into food and community neighborhoods. I also wanted to just share some photos from a mobile market or mobile pantries we've been working with. So this is a picture of Any Street Grocery, and then a concept mobile cart that we've been working with. We've been working with RTD and also Parks and Rec to get these types of mobile food pantries or food access points within their footprints. So how about a platform where you're waiting for a light rail train? How about a bus stop? How about a park or a rec center to have these located so we're having to tweak some internal policies related to what can be in these spaces, but they've been really great partners in working with us to try to make this happen and test this out. So other ways to get involved: plant a garden, donate a row, call Hunger Free Hotline and find out where your local pantry is so you can donate your produce that you're growing. Volunteer at a local pantry. Shop local. This is another one of our Healthy Corner Store owners, and they have been struggling a lot, but I think if we remember that there are independent grocers out there, not just King Soopers or whomever, that we need to support, because they too are trying to increase access to healthy products within their settings. And then support your local farmer. Donate to offset CSA boxes next summer, because a lot of our local producers give boxes to people who are food insecure. So if we give a little bit extra, somebody else will have more food. So I think that's it for me. And then we had some discussion questions, but we'll just open it up. Thank you, everybody.